Gupta is an MD in family medicine. He has a clinic in Green Park. He is, I would say, an avid acupuncturist, and he is going to elaborate on the role of acupuncture in depression. Over to Dr. Manish. He has, we know him as a diabetologist, endocrinologist. Today he is going to showcase his skills on acupuncture in depression. Over to Manish.
Yeah, I think the last session opened our eyes, and it's my duty to and do justice to the topic today, which is integrative approach for depression. Being a medical profession, I'm going to highlight of how does acupuncture fit into all of this. So without any waste of time, we're running behind schedule. So acupuncture and acupressure are widely confused in India. Acupuncture is from Latin, where acus is needle and puncturus is to prick. So it's using a needle to prick at the acupuncture points where you get a therapeutic response. That's what the science is all about. The origin, very interestingly, is not Chinese. In our Indian Vedas, there is mention of needle therapy way back in 7000 BC. Even in Sukhi Veda, the art of piercing with a needle of 180 points is known as Varma therapy, which is still practiced today in the Kerala science. In 4th century BC, the written text from China, the Neijing is there. So acupuncture was developed by the Chinese, but it's more Indian, but it was presented in a complete fashion by the Chinese and brought to the world. And therefore the Western science took interest in 1970s, so much so, the story goes that the President Richard Nixon was on his official visit to China. His cook got appendicitis and he had to be operated urgently at the hospital. As a courtesy visit, he was taken to see the hospital settings, and he saw open heart surgery under acupuncture anesthesia. And that alarmed him, and that he said that we need to get it to the West. That's how the story rolls, that the West got exposed to acupuncture and the interest grew. We just heard about the chakras, and we have to understand that the common link of who came first is very integrative. And being from the Indian soil, and I totally believe that there is a common connect between all the chakras and the acupuncture points. I think there's a cross link and there's a cross talk. So we can never say, is it Chinese, is it Indian? We should say it's a system of medicine which works holistically. And the reasons why traditional acupuncture has always been in the background, because of the pharmaceutical industry, the lack of knowledge, lack of therapeutic promises. Any alternative sciences, complementary sciences, always there's therapeutic promise. We can't promise the moon. Acupuncture, whether it's safe, unsafe, is it expensive in the Western world, and is there quality training? Are there quality professionals out there who are doing medical acupuncture? So the WHO didn't sit back, and the World Health Organization gave approval to acupuncture way back in 2002. It's a published thing on their website as well, and they classified conditions as per which conditions have been proved and be effective. So depression is right there in category 1. So acupuncture is there as per WHO. I won't bore you with the list, but category 2 is where the conditions have seen effect, but proof is needed. As medical professionals, we always believe in data, science, and evidence. So if you can combine the holistic approach with data, nothing like it. These are interesting category 3, category 4, whereas medical professionals also, we sometimes have limited answer to our patients. So acupuncture is worth a try as per the WHO, since there is no harm in doing acupuncture. What's the current status in India of approval of acupuncture in India? So it became a system, sorry for the blurred slides, but in 2003 it was that any trained professional, a medical professional, Ayurveda, homeopathy and practice. So the present government set out, thanks to ModiJi, that in 2019 a proper committee was formed to get the evidence, and it's almost on the verge of getting a regulatory mechanism as a separate system of medicine. This was asked recently in the Parliament in August 24. So the Indian government is working very proactively for the recognition of the system. I always share this prayer that there are certain things we cannot change, and we have to have the courage to know the difference of the things we can change. Why I'm saying that? Because everybody has said, oh, I don't know, is it a voodoo science? But I've been practicing 15 years and I see that. So acupuncture helps to rebalance the body. Whenever we get stressed, things flow out of balance, you all know that. And with acupuncture, we're trying to achieve that. Scientifically, we're just trying to balance the stress hormones. It works on the principle of chi, which is written as QI, but spelled as chi. Anyone's good health is always depending on the distribution of chi. Any imbalance in the flow of chi would lead to health problems. There are these 12 meridians which flow through our body, very close to the Ayurvedic system as well. So acupuncture does affect an emotional problems, coming to that. So in this system, like Ayurveda, we do not hear depression. We look at the cause of what's causing it and then we plan the treatments. So there are certain channels which have different emotions to them. So our allopathic system is designed to look only at depression as one part, but not looking at the underlying cause of what might be leading to that sometimes. So for depression, we have heard so much. I'm going to go forward, and the main concept is that we have to reduce the excess stress by using certain points which help that. In acupuncture diagnosis, it's not our Western diagnosis. So we use these 3-4 modalities, like same as Ayurveda, where we have Nadi Parikshan, history, and a complete analysis made of the dosha. Same here, we have history, tongue, pulse, and the acutograph system. So we use the tongue. The tongue, just in our Western system, would be just maybe a tongue, but in this system, it represents different energies. So we look at that. Different tongues represent different kind of constitution. We have a pulse diagnosis, which is similar to our Ayurveda, the Nadi Parikshan. We use our acutograph system, which is a Western tool to help us get into the energy systems. You might believe, might not believe into it, but this is where the trained acupuncturist would come in, where you would see so many syndromes of depression. It's not just one part of depression, and depression syndromes, this is a Western text saying what kind of symptomatology, what kind of pulse, what kind of tongue, and what other points should be given for that. So we have to kind of diagnose correctly and then move forward. Acupuncture, so long as the word over, is just not needle therapy. It's cupping, it will mop side with other things as well. I won't bore you with all of that slide. Ear acupuncture is a part of it, very interestingly. It's like an inverted fetus in the womb. And we have microsysteming for depression. These are the points which are sometimes commonly used along with the body points. And NADA is a famous protocol in the US as well. And this is just for food for thought here for everyone. Why do we pierce the ear? That represents the eye point. So maybe it was connected with the ritualistic point because it stimulates the eye and helps the eye. Ear is very interesting. It's got the embryological significance, and the only part supplied by 5 cranial nerves. So it's a very interesting part that you can affect the whole body by just using the ear. We have all seen this cupping therapy many times. Again, I think overhyped sometimes, and we can see our celebrities and sports people flaunting their cupping signs. But yes, there is some truth to it when they are getting into all of this. But coming back to, we are medical professionals, we are scientists at the end of the day. We have to have some evidence-based treatments. So this is the US overview of the CAM therapy, which is complementary alternative for depressive disorders, which was published by the Veterans Affairs US in August 2011. And they said that acupuncture has shown promise, and for manic depressive disorder, there is greater effect than sham on the depressive symptoms. For post-stroke depression, it was more effective than short-term use of antidepressants. So this is, ladies and gentlemen, the evidence which comes in from good clinical studies and data. So much so that the US, we have the role of acupuncture in the crisis response times. Even the police forces are using that, armed forces. And I think this is the future of medicine, where we talk of the word integrated medicine. Sabka saath, sabka vikas. I think that's what the truth is, that we kind of hold that all works together and we don't stand alone. And that's the kind of beauty, and I will sum it up. acupuncture is for calm, helps sleep and feel better. Everybody has a slightly different response. This is one of the statements from one of the Red Cross workers. Most of the patients come to me as a skeptic, but after the sessions, they mostly are saying the same thing. But again, it's a body-centered response. I'll end my talk here saying that we have to have open minds as medical professionals, and thanks to Dr. Sushil for hosting this holistic seminar today on this important topic. Thank you all for a patient listening.
Thank you, Dr. Manish. Any questions from the audience? Yes, sir. Naresh, give the mic. Naresh, come here.
Why is it not so popular in India? Because it came into India first.
Yes, sir.
But still, most of us don't know.
Archery, right? So by the end of it, the acupuncture therapy got lost. It is our own therapy, which is mentioned in the Vedas, right? So there is historical evidence to it. It's only the Chinese which made it more popular, and they made it evidence-based. So the West, it is evidence-based medicine now. Acupuncture is not evidence-based medicine. It's not I like it, you like it, nobody else likes it. It is like giving you paracetamol for fever. If it works for fever, you will give you paracetamol. Same with acupuncture, it's getting into guidelines all over the world. What is happening, your question, going back to the question, is the quackery, right? So we have to have trained individuals, professionals doing this. That's why the Indian government has set out to make it mainstream and properly regulate it. The current government is actually just on the verge of doing that.
Is it well regulated in the US?
Yes, sir. Yes, sir. Very well regulated. Very well. There are the proper colleges, there are proper certifications, and you have to kind of do that.
Is there any institute which offers acupuncture courses in Delhi?
So there are offbeat small people who are doing it on their own, but nothing is approved per se by the Indian government. The Indian government said you can do specialized courses. Like I did at my time, Indira Gandhi National Open University set out a course for the doctors, right, which was a diploma course at that time. But it kind of shut down, somebody's liking or some kind of political stuff. But as of now, it's small courses here and there. There are small courses. But the government wants to set up a proper kind of trained regimented program for the professionals to be proficient in it.
Now since you are into acupuncture also, Manish, are the courses in China, the acupuncture treatment different in China than the acupuncture treatment that we do here in India?
So thank you to ask that, and for that very well reason. Back in 2015, not 2019, let me be here. I had nothing to do with COVID back then. I stayed there for a month. For the exact same reason, I wanted to see the difference of it being practiced in US, in India, and in China. And I think it's like Ayurveda to us. What is Ayurveda to us is acupuncture to them. Right? For their common complaints, they would do acupuncture right, left, and center. Right? Like we would do our home care, or we would approach Ayurveda or a homeopath. So the seminar today is to integrate all these approaches for the management of depression.
How scientific is the cupping system?
How scientific is the cupping system?
Yeah, so coming to the cupping system, again, it is part of the acupuncture, right? So acupuncture is just not needles. So it has to be combined. What happens is that people start using cupping as just acupuncture, or just selling cupping as one thing, right? So cupping is a draining process of draining excess energies or the bad energy as per the science. But if we talk medical science, we are just basically causing increased blood flow in the muscles. So we're just causing the muscles to relax and kind of open up. That's the science behind it, if we just talk science. But talking that would cupping alone help, I think it has to be combined as a holistic treatment. Just selling cupping alone would not.
I remember talking to one coach was through advertisement only, that is, he said cupping for osteoarthritis and one drop 2,000 rupees. God knows how many drops.
Right. That's the exact reason what sir asked. There is so much quackery that whom to trust, where to trust. So until you have trained professionals doing trained stuff, right? That when you know the knee is gone, how can I get the knee back? right? So as medical professionals, you can try that as long as it's side effect free. But after a certain point, I also tell patients, sorry, something stops me. So that's my medical knowledge, right? That we have to have a balance of it.
Dr. Kapoor, sir.
Wonderful talk, Manish.
Sir.
As usual. Now tell me, it's research and accountability. The challenge. We don't have much research.
No, sir. By the WHO there is, and the research is growing. The challenge happens in the research is to do sham acupuncture, right? So in you will have a group where you will do actual acupuncture, and in the other group you will do sham acupuncture. So what's that group going to be? So that is a little challenge to for the research protocols. But whatever data we kind of collect, right, over time is slowly built up, and it's slowly building up, and it's just not my clinical experience.
I
It's
think
as per the data.
if our trained MBBS doctors take this, then people will have more faith. So it's very good that I could not hear your lecture.
No worries, sir.
But
Yeah,
if
yeah.
you are doing this, it's a great thing, I think.
Sir, in the US, many family medicine doctors take these things and kind of add on, right, to their sciences and kind of, do the thing. Sir.
मेरी डॉक्टर यूएस में रहती थी और वेरिकोज वेन्स का बहुत ज़्यादा पेन था उसको। डॉक्टर मनीष की 4 सिटिंग में अब 4-5 साल हुए हैं आज तक
Right.
That's all we have
Sir,
time
thank you,
for.
sir.
Thank you, Dr. Manish, for a wonderful. No, please stay. I would request Dr. Manish Gupta. Yeah.